Good evening. Happy Tuesday night. Welcome to On the Pen. I'm Dave Knapp, man on the Manjaro. That's why I'm here. You are on the pen. That's why you're here. Wegovy, Sextenda, Victoza, Trulicity, Manjaro, Zepbound, that pen. So thanks for being here for a special edition of On the Pen. Of course, we still have On the Pen live this week. We will be back live with a special guest this week. This week's special guest, Jamie from Triplet Dad of TikTok, post-weight loss surgery. And we'll be hearing from Jamie on his progress post-weight loss, which is extremely encouraging. So if you are excited to hear from Jamie, Triplet Dad again, put it in the chat and let me know that you're excited about that. But for those of you who are here in the chat tonight, I would just like to say a special welcome to Jennifer, Carly, Rudy, Clark, Sue the Dude, Sabrina, thank you for being here. Terrence, T, how are you? Allie, Anna, how are you tonight? See, who else do we have? I think that pretty much covers it. T, did I get you? Lisa, Deborah, Creamy Jalapeno. I love coming on. Matt, looking forward to Triplet Dad. That's awesome. So tonight's special edition of the show, thank you. Before we get started, make sure you hit that like, hit that bell, hit that sub, hit that like button. Let's let the algorithm know that this is worth watching. But tonight we're doing a recap of Eli Lilly CEO Dave Ricks spoke today at the JP Morgan Healthcare Conference of 2024. And, you know, when they do these healthcare conferences, a lot of times there's some news baked in there. You know, straight out the gate, I want to let you know there's not really much for new news, but there's definitely some interesting information, and we're going to get into it. Before we get into it, if you're new here, put an N in the chat next to your name and let me know that you're new here. I'd like to welcome you by name. There are always new people coming into the fold because there's so many new people taking Zepbound. If you're new here, especially if you're part of my Facebook group, Zepbound for Weight Loss, which is growing. We're over 5,000 members. We're creeping up on 6,000 now. So Wendy is new. Thank you for being here. Don is new. Don and Wendy, I hope that you will subscribe to the channel and stay in touch with us. We'd love to hear about your journey. Let us know what medicine that you're on. We'd love to hear. Matt's old. So many of you OGs here. So thank you for being here tonight. So good to have you here. It's good to be live back with you all again as well. So leading up to the JP Morgan, Creamy says she drove an hour away to grab a Drox at 12.5 Zep. And Sabrina said it's a good Facebook page. That's awesome. Leading up to this conference is where we kind of got some really interesting information from Dave Ricks, again, CEO of Eli Lilly. And so I want to talk a little bit before we get into the actual healthcare summit and what he said at the healthcare summit. I want to talk a little bit about some of the things that he covered beforehand in some of the interviews. I did cover these in my videos, which is another plug for following Man on the Manjaro, hitting the subscribe button. This is Eunice's third live video. So thank you for being here again. It's good to be here. Good to have you here. Yeah, so beforehand, I did these videos as he was kind of giving these interviews. So I want to just fly over those because I already did kind of cover this information. But hearing that retatrutide is 2027, more than likely. That was new for me. I hadn't paid super close attention. I knew that the stage 3 clinical trials had started for retatrutide this year, which I was very excited for. I was not anticipating that those studies were 80 weeks long. I figured that they would be shorter in duration than that. And so that said, we're looking at late 2026 before the clinical trials even end for retatrutide. So 2027 looks like when we'll see retatrutide. I was hoping for 2025. So it looks like we're stuck with tirzepatide. Again, my commentary on that is let not your heart be troubled. I know I myself was excited to get access potentially to Zepbound before that, or sorry, tirzepatide before that. Retatrutide, which again, Eli Lilly's CEO pronounces it retatrutide. Retatrutide. It's ridiculous. It's retatrutide if you follow this channel, and that's what it will be in perpetuity until they give it some stupid name for the market. So yeah, let not your heart be troubled about that, because we are probably going to see high dose tirzepatide before that. I've done a video on that recently. High dose tirzepatide is in clinical trials already. Usually when an indication already exists and they can show through a trial that the higher doses are safe and effective as well, then you usually see that hit the market pretty quick. So I'm excited for high dose tirzepatide. Let me know in the chat if you are excited for high dose tirzepatide. The other thing is that we've got 50 milligram Rybelsus ready to hit the stage this year. So Rybelsus, for those who don't know, is oral, a pill form of semaglutide. Semaglutide, of course, is also known as Ozempic, right? Ozempic is the diabetes version of semaglutide, a weekly injectable. And then Wegovy is its weight loss counterpart. And that is another weekly injectable. Rybelsus is the pill form. And so up until now, we've only had 14 milligrams daily of Rybelsus. So 14 milligrams of semaglutide daily in the oral form. We are going to have 50 on the market this year. So that's exciting because the weight loss at 50 milligrams of Rybelsus rivals the weight loss of Wegovy, which is the 2.4 milligram weekly injectable. So that's good news, right? High dose tirzepatide, high dose semaglutide. Of course, we've talked about how Wegovy is also being tested at the 7.2 milligram, which is 3 times the highest dose currently. So for those of us who need higher doses, Sabrina says she wants the 30 grams of tirzepatide. I definitely, now knowing that I've taken Ozempic, I know a lot of you want an update. I'll give a little bit more of an update on the pen this week. But yeah, I know that I can tolerate higher doses of both, honestly. And you know, 3 times the dose for Ozempic, I think I could handle that. 3 times the dose for tirzepatide, I probably feel like I could handle that as well too. So we'll see what it happens. My summation is that I'm guessing we're going to see 17.5 and 20 milligrams because of the way that they studied the 2.5 incremental doses, but they're pretty tight-lipped on that, as you can imagine. So 2027 retatrutide was something you talked about leading up to it, but not necessarily at the conference. LillyDirect, all right? So LillyDirect, let's talk about that for a minute. They announced LillyDirect, and I can't tell you how many people that I know who know I make content about Mounjaro and Zepbound that don't know much about the medication, who've come to me and said, hey, they're offering, Lilly is offering, direct-to-consumer medications. So let's just clear the air here. So that's not what LillyDirect is. LillyDirect is simply Eli Lilly's way of connecting you with prescribers via third-party lists of doctors locally that are obesity experts and willing to prescribe GLP-1s, and then a telehealth company called Found. Not Found. What is it? Y'all know in the chat. It's not super important, but Form, I think, was the name of it. Form. Connecting you with a third-party telehealth that'll prescribe GLP-1s for weight loss as well. Of course, Mounjaro isn't even available through LillyDirect. It's just for Zepbound and a few select other drugs. But they're using third-party telehealth, so you need to go get a doctor prescription still. And then they're using third-party pharmacies that they've contracted with. Basically, all LillyDirect has done, it hasn't cut out the PBMs. It's not a threat to the PBMs. This is still processed through your insurance. There's no financial benefit for you to go through LillyDirect. Really what it does is it's just more of an ease of access for the patients. Now, the other thing that I'll say is they have cut out the distributor. So the distributors who supply the pharmacies, they're supplying the pharmacies direct in this situation. That's something that I learned from Dave Ricks talking about this. And what that does do is, you've definitely seen the videos that I've done about the bootleg Ozempic pens that go around that are filled with insulin. It takes that worry out of it, right? Because there's no distributor, because the fake Ozempic pens are coming to pharmacies from the distributor level. So the fact that we cut out that middleman there definitely can give us a higher level of confidence that we're getting, actual brand name Eli Lilly Zepbound. So that is a potential win, as I think that you will see other spoofs, and as pharmacies are just desperate to get these, because the next thing that we're going to talk about is demand. It's going to continue to be an issue. Dave Ricks said with his own mouth that they will not be able to keep up with supply. So if you missed the video that I did yesterday, again, this is another plug to follow my channel, because I give you all this information throughout the week in bite-sized 1 to 2 minute videos, typically, where you can get all this information throughout the week. So make sure you hit that like, hit that bell, and hit that sub so you get notifications. But we talked about how the demand for Zepbound is insane. The last 2 weeks, both of the last 2 weeks of December saw 25,000 new prescriptions being written per week for Zepbound. That's 50,000 people in 2 weeks on the pen. So when I talk about this community growing, this community is going to grow exponentially. If you're new here and you're on Zepbound, please let me know in the chat. We would love to welcome you. Some of us are OGs. We've been around the block. So we're going to be able to answer a lot of questions that you may have about your journey. So yeah, so demand is going to continue to be strong, and we're going to continue to face supply issues. And I know that many of you here on the pen are already feeling that. So my thoughts go out to you, because it's just a certain level of anxiety making sure you can get your medicine each month. Chat's kind of quiet. I want to wake it up a little bit, interact with it. Who's excited to hear about the rest of the 2024 JP Morgan Healthcare Summit from Dave Ricks? So that's what I've shared with you currently, is what was basically shared by Dave Ricks on the shows, the interviews that he did before the actual thing started. So the dude said, it sounds like Lilly Direct cuts out the doctor more, or your own local doc. I don't think so, because they actually do connect you with local doctors if that's your preference, who were willing to prescribe. Many people who come into my chat or go on the website, fill out the form, and many people who ask me questions about this are saying, my doctor won't prescribe this. And so your doctor being uninformed about GLP-1s and how they treat obesity or diabetes is a huge impediment for people getting a treatment that can actually help them and change their life. So I think it's, at the end of the day, it is a win. So yeah, Sue said, Dave, would you advise those of us on Mounjaro to stay where we're at instead of switching? I absolutely would. I think that Mounjaro is probably going to be more available. So here's a bold prediction that I have for 2024. I think we're going to see the single dose vials. I think we definitely will see the single dose vials hit the market in the United States, because once the supply chain really hurts, that's how they're going to keep up being able to make these pens. Is a certain amount of people on Mounjaro are probably going to switch to the single dose vials, and it won't be Zepbound that'll be available, and it's only approved for the presentation for Mounjaro currently. So if you're on Mounjaro, I'd stay there. I think the supply is going to be a little bit more steady and predictable there. So I would definitely hang out on Mounjaro if it's status quo and it's working for you. Great. Thomas McIntosh, who is a huge contributor to the Facebook page that we have, the Man on the Mounjaro Facebook page. He's always given great information over there. So another plug for the Facebook pages that we run, that Zepbound for weight loss or Man on the Mounjaro over on Facebook. Let's see here. Just making sure I'm not missing any other questions. So let's get into the conference call, right? Or what was not so much a conference call, but a fireside chat. Speaking of conference calls, I do want to say, Sabrina, that's very kind of you. Thank you for the super chat. Really, really appreciate that, and appreciate all your encouragement, Sabrina, over here on YouTube and on TikTok as well. Sabrina, of course, a member of the Plus Sides podcast, and one of my faves, Sabrina. So thank you for being here. So one of the things that's interesting is at the end of last year in December, Eli Lilly did a forward-looking 2024 call. Like, here's what 2024 looks like for Eli Lilly. They skipped that this year, and they're actually rolling that into their 2024 quarter one or fourth quarter earnings call that'll be in February. So if you enjoy these kinds of updates, especially the earnings call updates, which are usually where the breaking news is for all these medications, then you'll definitely want to tune in February when I do that rundown, because we'll get the forward-looking call all in one there. So for purposes of this interview today is about 40 minutes. There are some slides that I forgot to upload. Darn me. Let's see if I can get those uploaded real quick. But one of the interesting things that was shared by Dave Ricks here in this little, it was more of a presentation because there's a slide deck and everything. And I'll share some of those with you. But currently, Eli Lilly has 110,000 people in clinical trials. Think about that number. I mean, most of us live in towns that are around that size. 110,000 people has Eli Lilly in clinical trials right now. And they've never had more phase 3 clinical trials going on at once. So even though they're in a big season of launching, like they're launching Zepbound this year, and they've got 2 or 3 other medicines that are non-obesity related that are in launch mode for 2024. So in the meantime, they're running clinical trials with 110,000 people in them. So just amazing what these large companies are able to do from an organizational level and accomplish. So that's a huge number. So let's talk about Mounjaro. So as far as Mounjaro, there was some talk about accessibility. So accessibility meaning people who are diabetic, who are being prescribed Mounjaro, being able to get it through their insurance. And that's at about 80%, which is rivaling its counterparts, Eli Lilly's own Trulicity, and obviously Ozempic, which is Novo Nordisk's semaglutide. So 80% is really good adoption rate for Mounjaro. They're working, of course, on getting more access to Mounjaro for pre-diabetes, right? Because there's so much that is offered by these medications in the way of mitigating full-on type 2 diabetes mellitus. And so I think that we are going to see hopefully expanded access to those who are pre-diabetic, who have maybe that borderline A1C, insulin resistance, things of that sort. So that's exciting. And then also looking at, the fact that Mounjaro could potentially be disease modifying for type 2 diabetes. In other words, starting studies that actually see if there is a reversal of diabetes or a change in the disease in people who take the medication. Thank you for the $10 super chat, Lisa. I really appreciate and depend on all of you too. So thank you so much for the gifts. They are so much appreciated and such an encouragement to me. So thank you for that so much. Before we get into Zepbound, I want to share some of these slides with you because I think these are a little interesting. This one especially right here. So check out this slide deck from today. So this is the timeline. So if you remember, one of the old On the Pens that we did from last year was all about Exidin 4, which was the peptide that was discovered in Gila. It's pronounced Gila. Gila monster venom, right? And so Dr. John Eng discovered this. Basically, people were coming in with basically bites from Gila monsters in Arizona, and they found that these people were becoming hypoglycemic. So there was something in the venom that was causing their blood sugars to go low. And so they basically isolated that peptide and brought Byetta to market, which was Exenidin 4. It was like the analog of that. So that's the first GLP-1 you had. Eli Lilly partnered with Amylin, the company Amylin, to bring Byetta to market, right? So that was the first one, and it was a twice daily GLP-1 back in 2005. So from there, you basically have dulaglutide, which dulaglutide is actually the market name for dulaglutide is Trulicity, right? So they went into phase 3 trials 5 years later in 2010 with dulaglutide, and 4 years later in 2014, they received the FDA approval for Trulicity, which took GLP-1s from by that time they had a rival in Novo Nordisk with Saxenda, Victoza, liraglutide, which was a once weekly injection. And they were able to once daily injection. So still a daily shot, but although it was an improvement over Byeta's twice daily shot. They came out, Eli Lilly in 2014 with Trulicity, which was a once weekly injection. Notice the pens are the same. And so that pen was pretty innovative. So then in 2017, you see the first human data of tirzepatide showing weight loss. So that was in 2017. And then you see in 2022, Mounjaro actually hit the market, and in 2023, the weight loss version Zepbound. So just a really interesting timeline. And now we know that in 2026, late 2026 or 2027, you'll add retatrutide, whatever you want to call it, retatrutide to that mix as well. So you see they continue to innovate in the GLP-1 space and be a leader in the GLP-1 space, even though we tend to think Novo Nordisk, right? The Danish company that makes Ozempic and Wegovy, because they also made Saxenda and Victoza. So Saxenda was the first GLP-1 that was actually approved for weight loss, and that was Novo Nordisk. So they kind of got the first claim to fame, but really Eli Lilly was the first to innovate in the space with the discovery of the Gila Monster and purchasing that asset and partnering with Amylin on that. So that's a really interesting slide. I'm definitely going to keep that one. We'll do a tic-tac on that one later. But that was a really, really cool piece of information that was shared in this stream. Let me know in the chat if you thought that was an interesting slide. I know that was something that I found to be fascinating. So here's another slide that just kind of shows something else that's interesting here. So you see here this pipeline. You can see that the pink, the drugs that are in pink were actually drugs that they've acquired. And you see there, nothing in the way of the GLP-1s, but you see bimagrumab, which they acquired from Versanis this year. And Versanis with bimagrumab is going to be paired with tirzepatide to preserve muscle mass during weight loss, which becomes, more and more interesting topic of conversation in the GLP-1 world. I hear the naysayers saying people lose 50% fat and 50% muscle mass, so they're just becoming skinny fat, which definitely isn't true. But that doesn't mean that it's not something that we don't want to put any emphasis on. So obviously Eli Lilly sees this as an issue or potential issue. So you see bimagrumab, which will ultimately be paired with tirzepatide in some sort of combination medication. And that's in phase 2 clinical trials. So we know that we're several years away from that, but that will be an interesting thing to pair it with. And then obviously you can see just where we're at phase 3 clinical trials for retatrutide, of course, or orforglipron, which is the small molecule daily GLP-1, non-peptide GLP-1. So this will be able to be mass produced, right? So when you talk about accessibility, not just within the borders of the United States, but around the world, orforglipron will be a real game changer in accessibility to GLP-1s in the global fight against obesity. I also think the orforglipron is a real big sleeper for maintenance, right? When you talk about maintenance, I think most people would probably prefer to take a pill rather than a weekly injection. Hopefully, the cost will be a little bit more attainable for people as well, just because it's a pill. But if we're going by Rybelsus and the pill form of semaglutide, probably not. And orforglipron will be novel in that it will be the only small molecule GLP-1 non-peptide. So who knows? It'll probably be ridiculously expensive. Definitely will be ridiculously expensive, but hopefully, it will be much more scalable than other GLP-1s. So from an accessibility standpoint, that'll be fun to watch. So let's get back. Well, there's one other slide I'll share with you too. This one was just an interesting slide. So if you see, one of the things we talked about, Eli Lilly has historically been good at finding one thing they're really good at and sticking with it. Obviously diabetes. And you think about insulin, what they've done with insulin. So diabetes and cardiometabolic diseases, oncology, neuroscience, and immunology are their 4 main focuses. And if you look at the other side where it talks about speed, just look at how much faster they've gotten from, introducing something to human testing to, basically coming up with a molecule to getting it tested in humans has gone from 3 to 6 years from 2015 to 2017, down to 2.4 years from 21 to 23. And then from the first human dose in trials to launch, it was up to about 10 years between 2011 and 2015. And now they've got that down to 6.2 years. And I think you're going to see this continue to increase as you continue to see partnerships with Eli Lilly and, the host of AI companies that they're partnering with that are going to even, really help identify drugs faster, right? But I think it'll also help to improve the development speed of these medications. And you see more and more Eli Lilly's partnering with some big names, including Google, right? Alphabet, who has a company that is, the name escapes me, but I did a video on this the other day. And they have partnered with basically Google, an AI company that Google owns to help develop medicines faster. Sorry, lots of talking. So fascinating stuff. Susan Dude gifted 5 membership. Thank you. I appreciate that. Yeah. Thomas said they also have a phase 3. Deborah, I missed that too. Thank you for the $9.99 super chat from Deborah. Thank you. Thank you for those who are becoming members of the channel. I really, really appreciate that. Matter of fact, YouTube gave me the ability to gift memberships. Hey, if you're watching this on Facebook, this is a good time to encourage you to share this video out with anybody who you think might find it helpful. There's more and more of you, so make sure that you share it into any of the groups that you're in, and that'll really help get the word out on this channel. Thank you for those who are doing that even as we speak. But if I join the live here on my phone, one of the things that I am able to do is gift some memberships now. It's going to let me do that. Probably wants me to be on a desktop. Shoot. Well, maybe I can pull that up here in a little bit, but I don't want to get too far off task here for those who will be watching this after the live. Let's talk about Zepbound. So let's get into Zepbound. Zepbound was so Sue said, sorry, answer Allie's question. What was Allie's question? Sometimes if I miss a question and you want me to answer it, sometimes it's better if you just re-ask the question, because I got to go up in the chat and find it. Will the retatrutide be for type 2 or just weight loss? It's actually going to be for both, Allie. So it's in stage 3 clinical trials for both obesity and type 2 diabetes. So you're going to see a launch around the same time. So that's good news, right? Yeah, right. I don't think there's going to be the lag that you've seen with the other drugs. They're doing it kind of in tandem, which is great news. So awesome. So Zepbound, obviously they're excited for the start. We talked earlier about the 25,000 new prescriptions a week and how much of that demand is organic because of this right here, right? You got a guy who's devoted a good chunk of his life to On the Pen, right? Man on the Manjaro. So that's what they call organic growth in the business. Little evangelists like me whose lives are being changed by these medications and take the time to help spread the word to you. So if you have found this content interesting, if it has helped you in your journey, put it in the chat, share this, like this, do all the things to give back to the stream. But yeah, this is organic growth right here. That's what you're seeing. Positioning, they want to position Zepbound obviously as the marquee name in GLP-1 for weight loss. And they obviously know that that's not the case right now, right? Everybody thinks Wegovy and Ozempic, primarily Ozempic, right? But they want Zepbound to become that marquee name. And I think that's why they went with the name Zepbound. It's it kind of has that air of dominance, right? Zepbound. Ananya wants to know what my thoughts are on the clinical trial about the head-to-head of tirzepatide versus CagriSema. I wasn't aware that there was a head-to-head trial between tirzepatide and CagriSema. I know that there is a head-to-head trial between tirzepatide and semaglutide. Actually, that is vaguely ringing a bell. CagriSema, I think, is going to be amazing. I think we're going to see CagriSema before we see retatrutide. So I should have mentioned that earlier. CagriSema is obviously semaglutide, so Ozempic, right? Plus cagrilintide, which somebody's going to have to remind me what the mechanism of action. I believe it acts on the amylin receptors. So another hormone in your body responsible for satiation and things like that. But yeah, I think that the prospect of what CagriSema will be, it will definitely rival tirzepatide, right? And it may bring something else to the table that tirzepatide doesn't, in that amylin is not a GLP-1 hormone. It's just another hormone in your body responsible for helping you feel full, right? Clark says it is produced along with insulin by the beta cells in the pancreas. What company makes that? So it's CagriSema. So semaglutide is Novo Nordisk, Cheryl. So yeah, I think that's going to be an interesting trial to watch. And I think you may see, I don't think that Novo Nordisk would be doing the trial if they didn't think amylin was going to edge out tirzepatide. Now, I think a lot of that's going to be how they structure the trial, in terms of how long the trial is, in terms of the patient population that they're testing it in. But yeah, TBD, right? So they are, one of the interesting things that he shared was that, a lot of the conversation that happens in this community is around, my insurance doesn't cover weight loss medication. And then we as creators are always pushing people back to, well, it's your employers who opt in or don't opt into obesity medicine. Let me know in the chat if this year your employer added obesity coverage. And let me know in the chat also if your company removed obesity coverage, right? Because basically the news that Dave Rick shared was positive from Eli Lilly's perspective, in that even though there's been a lot of bad press about this, that 15 to 20% of employers actually added weight loss coverage last year. And that was before the SELECT trial information dropped, which was basically the news from Novo Nordisk that Wegovy, the 2.4 milligram dose of semaglutide, reduced cardiac events in people with heart disease by 20%, which is just amazing. Actually, I want to say it was heart failure, right? So that was before that good news drop, which is going to be, more incentive for employers to add the medicines, more incentive for insurance companies to add to their formularies. And in that vein, he talked about how next year they have readouts on the studies for tirzepatide in heart failure and sleep apnea. Now, this is good news for those of you who are on Medicare, because even though Medicare Part D doesn't reimburse obesity medicines like Zepbound, you can get Mounjaro for diabetes. But if you're not diabetic and have heart failure or sleep apnea, which are very common occurrences in the elderly population, right? That's your backdoor way into getting reimbursement for tirzepatide in the form of Mounjaro on Medicare. So that's really good. Once those readouts come, that's going to be really good news for Medicare, the prescribing end of it, and the reimbursement rates for Medicare as well. So they expect that government formularies will move even more so when those readouts on heart failure and sleep apnea come out for tirzepatide next year in 2025. So, some other topics they talked about is like, how long are people on the medication? That's something that this is an investor call, right? So they always are concerned, the investors, is how long are they going to be on the medication? Are people going to keep taking it, or are they only going to take it for a little bit of time and get off of it? He said the best thing that they have to compare it to right now is Trulicity, and Trulicity doesn't even come close to the benefits of Mounjaro when you're talking about things beyond just simple glucose control. And so it basically said Wegovy isn't a good match to look at, even though some articles out there are comparing Wegovy numbers, which I'm not sure what they are off the top of my head, but Wegovy has experienced such issues with accessibility and so many people paying out of pocket for it that it's not a good comp, right? But they think that they're going to have a pretty good readout on what the long-term use rate is on these medications. I have a feeling, like, I don't meet very many people on Mounjaro who are like, I can't wait to get off it. Most of us are more than willing to take the medication for life if that's what it means for us to control our chronic disease, right? 500,000 people right now are on a branded GLP-1 for weight loss. And so if you think about that in terms of the number of what the market is, the market is 110 million people. So you have 500,000 on a branded GLP-1, so non-compound, right now, and the market is 110,000 people. So this market is huge. With that said, they're never going to be able in the near term or even I think the long term to keep up with demand. Demand's going to continue to be a huge issue. And that's where the small like orforglipron and Rybelsus and the continuation and development of oral versions of this are going to be so important because they're so much easier to manufacture. And then post-manufacture, obviously these pens require, whether you're talking about Ozempic, Wegovy, Saxenda, Zepbound, these require cold storage all the way until they get to your house. Pills don't require that. So you think about the money that's involved in that. And so these pill forms are going to be really awesome once they hit the market. I agree, Matt. There's just no way that they can possibly keep up with that demand. So very, very interesting news out of the, nothing breaking, nothing like earth shattering, but just fascinating more than anything. So that's basically what I had for you from a recap from this year's 2024 JP Morgan Healthcare Summit, right? I hope you enjoyed it. I want to interact with the chat for a moment. If there was any questions that I missed, please throw them in the chat now. Natalie sleeps 100 times better now. Was supposed to get a mask and everything for sleep apnea 60 pounds ago, and now the doctor says no. That's amazing. It's absolutely amazing. Natalie was addicted to sleep gummies and still didn't sleep well, and now she never needs melatonin, which is amazing. James Brown is in search of weight loss and body. James Brown is a spammer over on YouTube. We get a lot, or over on Facebook. We get a lot of those. Tammy Trump, welcome. Good to see you here. Thank you for being here. Your pharmacy has 10 milligrams of Zepbound waiting for you, waiting on a PA for approval. Worried your docs here in Montana aren't too familiar with it yet, which is another reason why Lilly, that's exactly why Lilly launched Lilly Direct, because of what Tammy just said. There are so many doctors out there who these are new medications for, and they're just not comfortable with prescribing them. So Lilly Direct, if nothing else, will connect you with a provider who is comfortable with prescribing them. So I'll give an update on Ozempic on the pen this week. But since you're here, Matt, and since you're such a great contributor, I'll give you an update. So I'm on Ozempic, right? I'm man on the Ozempic currently. It's status quo, Matt. I'm not losing and I'm not really gaining. I find myself just same thing with Ozempic as with Zepbound. I think I need the high dose version of these medications to get the same benefit that other people get. Same kind of story, I feel fuller for longer when I eat, but I definitely have more food noise, right? So I'm hungrier on balance, right? I think about food more than I did on Mounjaro, but that's not, the food noise wasn't ever completely turned off with Mounjaro. It's never like I couldn't eat. I was always, I always had an appetite, but maybe a little bit less of an appetite on Mounjaro. Full appetite on Ozempic, but when I eat a meal, I just stay full for a really long time. So that is what I love you, Matt. I love you. So yeah, that's the update on that. Anna lost 110 pounds on Mounjaro and then compounded for cost as she went on Medicare, and she was on a CPAP, and the pulmonologist took her off it. No more sleep apnea. That's amazing. And those studies that they're doing right now come out soon. So Jennifer from Nebraska said the snow plow finally came through. Yeah, we had a big winter storm here, so I spent a lot of time this morning digging ourselves out so I could get to work. Kids didn't have school, so that meant the wife didn't work today. So awesome. Anna said that HMG A1C dropped from pre-diabetes to 4.5. That's just amazing. Amazing, amazing, amazing. My last ask of you before we go tonight, would you please join me for On the Pen Live this week on Thursday, 9 p.m. If you enjoy On the Pen, drop the emoji in the chat, right? Members, drop the OTP emoji in the chat. Let me know that you enjoy it. Let me know if you're excited to have it back live again this week, right? With Triplet Dad of TikTok, who's going to be sharing his progress from weight loss. We got some other really great interviews. Lee Fitzen will be back this month. Texas heart doc, a cardiologist from Texas will be on to talk about his own journey on GLP-1. So if you all could hit that like button before we go. And for those of you who are not members, if you want to become a member, get access to those custom emojis that you're seeing in the chat, and then access to members only videos. We'll get back to doing the members only live stream before On the Pen, all those things that we do here, often imitated but never duplicated on the pen. There's nothing like it. Make sure that you hit that like, hit that bell, hit that sub, and consider becoming a member. Thank you for gifting the memberships tonight, Sue. Special shout out also tonight to Jennifer for renewing her membership, Sabrina for the super chat, Lisa for the super chat, Deborah for the super chat. You all are the best part of what I do. You allow me to have fun with this, right? Who would have thought a year ago when we started this thing, over a year now, 13 months now, but we'd have it's a whole deal over here, isn't it? It's a whole deal, and it wouldn't be the same deal without all of you. Can't wait to see you Thursday night on the Pen Live with Triplet Dad of TikTok, Jamie, to tell about his weight loss surgery journey. Thank you again, Vikranth. So we got a comment from over on X. I think that's the first live comment we've ever got on X. Vikranth, thank you for being here. Consider sharing this somewhere on X. Love to hear from people on all the platforms. But yeah, until we see you next time, we'll see you out on the pen, right? Whether that's Ozempic, Mounjaro, Wegovy, Ozempic, Saxenda, Victoza, Trulicity, whatever pen you're on. We're just glad you're here. Thank you for being here with me tonight. We will catch you on the next one.